And now, could I ask for some comments from Sarah Gollust, an alumna of the same program that gave David his PhD at Michigan, and now a professor of health policy and management at the University of Minnesota?
Hi, it's a pleasure to be with all of you today. And it was a real pleasure to get the opportunity to read David's book, Continuing the Gift Metaphor, that Jamila set up. This really is a gift. This book is a gift because it provides hope. So often in the research literature around health equity, the social and structural determinants of health, and the impact of systemic racism, we feel like there is no way forward because these systems have done such an effective job of oppressing people, keeping people trapped, and also at the same time advantaging others unfairly. And it feels so hard to understand what we can do, what sort of pathways we can pull, or how we can be able to create a different future. But this book is called Ripples of Hope because those little bits that tell us how change can happen and a pathway forward are so clear throughout the book. So the gift I got was this gift of actually feeling hopeful. And the fact that I felt that in the context of the sort of personal tragedy that you've already heard about for David and his family and friends, as well as thinking about the context of broken systems, electoral systems, and social systems. It's truly remarkable to feel that hope from reading this book. So I'll share a little bit about who I am and how reading it sort of relates to my different identities as a scholar and a teacher. So the first lens is, as you just heard from Scott, I'm a graduate of the same program as David, and so did have an opportunity to know him. Also similar to Jamila, I think David thought of me as a mentor, but there were so many times that I learned more from him than I think vice versa. So I work in a health policy department in a school of public health, and so I can speak a little bit to how public health scholars will receive and gain so much from this book. And then the second lens is I work as a scholar of communication. So I'm keenly interested in how we can explain really difficult topics to audiences outside of the academic community. And that's another example of what this book contributes. So thinking about that latter point about communicating the structural and political determinants of health, this book is such a good example of showing, not telling. So we in public health, I think, and in the broader public discourse have adopted, I think, an unfortunate tendency to use buzzwords to say health equity is this and structural racism in this, and those are the words that should motivate people to act differently, whether those people are scholars, researchers, everyday residents of the United States, or the policy community. And I don't think that works. I think that using those buzzwords is unlikely to produce the kind of change we hope for. But instead, what we need is a deeper structural understanding so we can actually see what are the policies and environments that have constrained health. And on the counter, what are the policies and environments that can open up the opportunities for improved health? And so what this book does from a communicative perspective is just demonstrating over and over what systemic racism actually looks like without having to rely on a shorthand of that concept. And this theme applies, as you've heard, to the Mississippi Delta, but hopefully readers will take from it that these systems and these ways in which we are constrained or given unfair opportunities or unfair disadvantages from our systems will come out and be illuminated wherever we happen to live, wherever we happen to be reading the book. This is really important because we know from social psychology and other literatures that the individualistic default explanations for health are so very strong. They're strong in all of us. And we need the type of explanation and insights that David has been able to provide in this book to get out of that trap of thinking about health in deeply individualistic ways, or thinking about people's sort of quote bad behaviors as the reasons why we systemically see these disparities across race, ethnicity, social class, and so many other dimensions of difference. So I think you can't help but come away from this book with a deeper understanding of how structural racism operates. I know I did, and this is a space that I've already worked in. Just as an example, I call out, I urge you all to read the book. Again, many systems are described from food and education and healthcare and so on. But the education example was a particularly poignant one to me as a reader, in part because it's the area that I think I knew least about before I picked up the book. And I think David felt that way too. He says, if I had a magic wand and could improve one social issue because of the effect it would have on health, it would be education. So he goes into great detail about all the ways in which education curtails opportunities and all the ways that it could be improved to create more opportunities and overcome systemic barriers. So then the second area of contribution is taking off my research hat, putting on my educator hat here, and thinking about teaching in schools of public health and my students and colleagues. I think so much of the discourse in public health you've just heard is so deficit focused, so risk related focused, and thinking about race as the risk factor for myriad health outcomes rather than racism as the risk factor. And this book does not fall into that trap. I could tell from reading it that David had a real mission to not pile on more deficit-based understandings of health disparities, but to provide a really important counterweight and alternative. And he also focuses on solutions. So not just focusing on the problem, but really a clear-eyed look at what could be the potential solutions. And those solutions that he highlights in each chapter are those, not that he from a far off distance is suggesting might work, but those that were voiced by the people he spoke with in the Mississippi Delta, by the community organizations, the individual people, the youth even, who live in those environments and who are themselves suggesting what solutions they perceive to be likely or possible if the political winds and power would change. And that's, I think, the last contribution is really his focus, not just on the public health, the systems and practices, but also his attention to thinking about power and politics. So one thing that his contributions throughout his research career have done is provide both policy analysis and attention to the politics, which is, I think, so deeply needed. The health equity policy agenda he describes is audacious, it's important, but it can only happen if we see distributions in power, who has power, and whose power needs to be taken away, to put it mildly, so that we can see the types of changes realized for improved health in the Mississippi Delta and in so many other communities. So last, for any public health researchers listening today, he really says it's important to have some cross-training in political science, really thinking about not just creating a section at the end of a paper about policy implications, but really having a much deeper understanding of how those policy solutions might come to be. So it's a real call for interdisciplinarity, for the value of interdisciplinary teams that can think about these issues, both in terms of the data, the stories, if you've already heard, that are so powerful, as well as attention to what politics would require to change the conditions. So I know I'll be reading this book. I will be assigning this book. I will be giving it as gifts. And I look forward to further discussion. So thank you.